Good afternoon. Thank you so much for being here. I know for weeks and weeks now, many of us have been in the streets because of the things that are happening within our country. And all of those demonstrations are important to stop the cuts to unions, the attack on unions, the cuts to the Veterans Administration, the cuts to science, the cuts to education, the cuts to Medicaid, the cuts to Medicare, and the threat against Social Security and everything that we hold dear. So we have to keep up that effort. But this group here today is very special because not only are we saying stop the cuts, we're saying go forward. Give us a healthcare system that takes care of every single person in the country, that takes away the barriers that are stopping people from getting care, that frees physicians from the control of the insurance industry, and that frees patients from the economic barriers that are causing too many of our people to die too soon. So welcome. You're very important people, and we're really glad you're here. I'd like to ask before we leave that you sign in, because just in case Congress doesn't act immediately on our demand for single-payer health care, we got to have a way to stay in touch to plan the further activity that we will need to do. So I ask that you sign in before you leave, and take whatever literature you like. It's over there, and we have free bumper stickers as well. And I would now like to introduce this wonderful group of women that are standing around me. Oh man, I'm so sorry. The group of women and men who are the Kentuckiana Raging Grannies.
Your claims denied and you're on your own. Saving My doctor should make the decisions, not profits from old corporate ties. Insurers are calling the shots now, while patients are left high and dry. Give back, give back, oh give back my health care to me, to me. Give back, oh Medicare for all, let it be. They say that it's just too expensive, but millions go straight to the rich, while families are drowning in debt now, and finding care's just such a bitch. Bring back, oh bring back my health care to me, to me. Give back, Medicare for all, let it be. No more should a child go without it, no elder be forced to decide between food and pills they depend on. Single payer can give back their pride. Give back, oh give back my health care to me, to me. Give back, Medicare for all, let it be. Let nurses and doctors be trusted, not boardrooms with profit in mind. Our health is a right, not a market. It's time that our laws realign. Give back, oh give back my health care to me, to me. Give back, single payer is destined to be.
In case anybody hasn't noticed, he's holding up signs over here, so you are part of Raging Grannies and Randy Grumpies, okay? Sing along. Hey, John. All right.
How many times must our health system fail with insurance plans at the reins? How many times must premiums raise or charge us higher pays? How many times must our budget go broke before we will use our brains? For healthcare really fine, HR 3069, Medicare for all, now's the time. How many times million a year. If insurance plans were not here, our healthcare really fine. HR 3069, Medicare for all, now's the time. How many bankruptcies will we allow before claiming healthcare as our right? How many deaths will it take till we know that too many people have died? How many miles will we permit before U.S. voters show our minds? For healthcare really fine, HR 3069, Medicare for all, now's the time. Get your Congress rep to sign HR 3069, Medicare for all, now's the time.
So we are not an exclusive group. If you can carry a spoon and a bucket and you're mad as hell, come join us. Yeah. We work on Thursdays. Bucket is really the optional stuff. You got really we got buckets. We got a place for you.
So you two can join this group. Who should they see? See any one of the people in the hats. They're going to sing again at the end. So the plan is that we have 4 speakers, and then we have a narrative to talk about our healthcare system, and we will end with other singing, and at 1 o'clock or thereabouts they're delivering pizza for all of us. We hope you'll join us. I woke up this morning to find in my Google alert that there's a demonstration from a group called Down Home North Carolina in Burlington, North Carolina, and they're fighting for single payer today just like we are. That's one of 3 in North Carolina. There's one in Houston, and there are 25 cities across the country that are raising the demand that we remove the profit from healthcare and allow everyone to be covered and use the money that we will save to improve coverage for all of us. That's the plan, and we're going to make it happen. So. Now I'd like to introduce our first speaker. He is from Louisville, and he is the president of the Kentucky AFL-CIO. That's the large organization of just about all the unions in the state. He was formerly the president of the Kentucky State Building and Construction Trades Council and vice chairman of the Bricklayers and Allied Craft Workers Local 4 in Kentucky and Indiana. He hails from a family of building trades union members dating back to his great-grandfather, who was a union carpenter. And the Bricklayers have this in their mission statement: to unite our brothers and sisters in a common goal of the best possible health and welfare throughout their career and retirement. Yeah. We're so happy to have Dustin Reinstedler.
Good afternoon, everyone. Sisters, brothers, and siblings, today we gather to say enough is enough. Enough to a system that lets billionaires profit off of our pain. enough to a healthcare industry that's run like a hedge fund, and enough to a government that listens to a lobbyist before they listen to working class people. We are here to demand Medicare for all, not as a luxury, not as some dream, but as a basic right. We don't need more GoFundMes for insulin. We don't need to be skipping checkups because your deductible's too damn high. We don't need to tie our health care to whether or not the boss likes you that day. So let's call out corporate greed. This isn't just a broken system, it's a rigged system. Health insurance CEOs made record profits while folks in Kentucky buried loved ones because they couldn't afford care. Pharma executives are swimming in bonuses while rural hospitals are closing right now. That's not a market failure, that's greed. Now we've got Dodgy, whatever you call it. Elon Musk coming in and gutting what's left of a safety net. They want to streamline us right into privatized Medicare, right into low-wage gig jobs with no benefits, and right into a future where billionaires live forever and we die waiting on approval letters. It ain't right. So what's labor's role? Unions always have been a firewall between working people and unchecked greed. We've bargained for health care, but we shouldn't have to beg for it. Every single person, union or not, deserves health care from cradle to grave. So it's time we stand up to the corporations that seek our bodies as profit machines. It's time to stand up to billionaires who think their money makes them kings. And it's time to put health over wealth, care over corporations, and people over profit. Healthcare for all is not some radical idea. What's radical is letting Wall Street decide who lives and dies. And we're not asking anymore. We're organizing, we're fighting, and we're going to win. Solidarity.
Love it, Dustin. Bricklayers build up and create. Doge is tearing down. So we're on the side of those who are creating and building and working for a better country. Okay, it's now my honor to introduce our second speaker, Dr. Karen Krieger, and she has so many credentials I won't be able to get to all of them, but I'll just give you a taste of who this woman is. She is a professor in the Department of Family and Geriatric Medicine at the University of Louisville School of Medicine and Director of Health Equity for the U of L Health Sciences campus. She's a Louisville native, received her BA and Masters of Education and medical doctorate degree from the University of Louisville. In 1992, she joined other faculty in starting an HIV clinic, and she has served on the American Academy of HIV Medicine's National Board. In 2014, she received the U of L President's Distinguished Faculty Award. She has provided presentations locally, nationally, and internationally on HIV, infectious diseases, and primary care for more than 35 years. I got to know her when she held health fairs at the Redeemer Lutheran Church to try to bring the best of healthcare to her community, and she allowed us, those single-payer advocates, to be a part of informing that community. She's a courageous fighter for our health through her professional practice, her teaching at the School of Medicine, and her bold stand for single-payer healthcare. Dr. Karen Krieger. And her sign holders who are going to help her to get her message.
And I got 4 to 5 on that side. Let's put 2. No, 2 on that side. There you go. And then we got 3 here. There we are. And 4 is down here by 5. Okay, the other end. Thank you. All right. Whoa. There goes I'm used to doing this with PowerPoint, so I have to have visuals to get myself together here. And Redeemer is still doing their thing. It's their 33rd year for their annual Street Festival and Health Fair, and I hope you guys can join us for that. We're going to talk about what our healthcare system is about. You guys know it, but we're talking to the general community. We're one of 25 cities that are talking about needing one national healthcare plan. Medicare isn't perfect, but it's the best we got now for expansion. I'm going to go through some of the parts of healthcare. In Medicare, we have in this country one of the most fragmented healthcare systems in the world. I'm going to start with Medicare A. If you're 65, you get it. They pay for it. But you got to sign up 3 months before you turn 65 or 3 months after you turn 65 or you're penalized. If you are awarded disability, you don't get Medicare for 2 years after the award. In Medicare A, it only pays for hospital, but that's only for 60 days and after you paid your $1,600 deductible. If you didn't know it, that's what it was for 2025, $1,600 for each hospital location. Medicare B pays the doctors in the hospital and your outpatient visits, and D is paying for your prescriptions. Most people are paying for B and they're paying for D, and those are big expenses. Medicare C is the Advantage plan. Now we've got 60 Medicare D plans for prescriptions. Do you think I'm going to know which formulary my patients are going to be on? It's a mess. We have 36 Advantage plans, which a third of them are under investigation because they're not giving their patients what they're supposed to be giving under Medicaid. So we have a broken system, guys. There are 78 countries in this world that have universal health insurance. These countries include UK, United Kingdom, the Netherlands, Denmark, Canada, Australia, and they have better health care than we have.
That's right.
Here, if you're looking at my posters, it talks about how we're doing with the other developed countries in the world. And the first one here, we're worse. All the other comparable countries are taking better care of their patients. The second one, we are spending twice as much per person on health care than comparable countries in this world with worse outcomes. And the third one here, we have more deaths, we have a higher mortality in this country of people than the other developed countries in the world. Shorter life expectancy, spending more money. We need a patient-centered healthcare system reflective of the social determinants of health so that people can get to their appointments. Transportation's a barrier when you get to be a certain age. We need a system where there are prescriptions that you can afford, not because they are not being given by the corporations at the cost that we have to pay for. We need to take care of those things. We need exercise opportunities in all of our communities to stay healthy. We need to have providers having more than 15 or 20 minutes to see a patient. We are not Pep Boys or the Ford assembly line. You are not units to be counted at the end of the day. The bean counters have set up how health care is delivered in this country. We need to understand the digital divide. So many of us are being asked to take our information, our healthcare summaries online. Not everybody knows how to utilize the QR code. Not everybody has computers, software, or knowledge. There is a digital divide, and there's a move in this country to move everything to computers, which is leaving out seniors, leaving out marginalized communities, leaving out rural communities that don't have cell towers and don't have internet access. We need health education and education in general, not just for the youth, but for the seniors. Because we still work, and we're capable of it for what we can do. A chain is only as strong as its weakest link. If people are working and they can't afford to have the medications to stay healthy, they cannot be effective in their jobs. For us to be competitive globally, for us to be effective, and I'm going to speak as a baby boomer, if you look at the population, there's an inverted triangle. Up here are the baby boomers, that's us. Down here are the youth. There's not enough of them to do the work. So we have to march. We have to march. We have to get what we need to stay healthy. That includes things like hearing aids, dentures, and eyeglasses so that we can continue to do the work that we have been doing in our lives. And, sum it up, gray. When a child gets 18 on Medicare, he has no insurance. Now we have it if you have private insurance, your kids are covered to 26. We need it birth to grave. We have infant mortality in this country higher than some third world countries. We need to cover everybody, and we need to cover everybody knowing that we deserve to have public service in our health, not corporate service. Thank you. Your action call, take down the phone numbers for the senators in Kentucky, Senators McConnell, Senators Paul. We want national health insurance to be put on the national agenda. We want that to be a priority. And if we've got 25 cities talking about this today, I'm hoping that they're sharing the phone numbers for their senators so that this gets put on the national agenda.
If you don't have a pencil, take a picture.
Thank you, Dr. Krieger. Our next speaker is someone I've been privileged to know for just a short time, but he is doing wonderful work. His name is Hamza Jamal. He is a medical student, and not only is he studying to take care of patients, but he is fighting to build a healthcare system that allows him to do that. And he is the founder of the student chapter, the Students for a National Health Program at the University of Louisville School of Medicine. He's in the graduating class of 2027, and I'd like to introduce Hamza Jamal.
Thank you, Kay, and everybody that helped organize this event. So, as a medical student, you might be wondering what I'm doing here instead of studying. But to answer that question, I am here as a medical student because I'm concerned about my future patients. I'm concerned that I'll have to spend more time talking to insurance companies than talking to those patients. I'm concerned that every day we're allowing so many people to suffer and die. We all have the tools available to help them. As many as 10% to a third of the US is underinsured or uninsured. How can we lead the world in medical innovation and cutting edge technology yet can't even deliver it to our own people? It is a failure on our healthcare system, one that is designed to take care of people in their most vulnerable state, yet disregards so many. Small illnesses, minor injuries, spiral out of control and turn into preventable hospitalizations. No one should ever have to skip medication or delay care because they can't afford it. So I ask, what is the point of studying medicine if it is not meant for everybody? A single payer system answers this question and enshrines it into our society. Everyone has a right to healthcare, no matter what you look like, where you come from, or how much you're worth. Our healthcare system spares no one. It is not just patients that feel the effects, even those inside of it feel mistreated. Every day, physicians spend less and less time with patients as our system forces them to complete more and more administrative tasks. A 15-minute checkup turns into hours of charting. Simple exams turn into endless codes that patients can be charged appropriately. Life-saving treatments turn into endless back and forths to get prior authorizations. I ask, what is the point of studying medicine if I can't even practice it? A single payer system is the best solution. No life should be put on hold because of a delayed form. No physician should have to beg for permission to heal. It's time to return the decision-making back to the physicians. But who is to blame? For years, for-profit insurance has been creeping and growing like a cancer throughout our system. Hospitals, pharmacies, even front lines like emergency rooms have been caught in the crossfire. Profit is being extracted down to every last breath you and I take. I ask, what is this point of spending trillions if it doesn't actually care for people? Somehow the US spends more money than any country in the world, yet we have nothing to show for it. Endless administrative rules are being created while the number of physicians is dwindling. A single payer system is the only way to eliminate billions in wasteful spending and return it to what really matters, putting patients at the center of care. So you ask again, why am I here? I'm here to demand a new vision for healthcare in the US. One that enshrines healthcare as a right, not a privilege. One that ensures physicians get back to what they studied for, not fighting billing codes. And one that ensures the elimination of private health insurance. Join us as we demand a healthy future.
And now it's my honor to introduce Gail Henson, who is a professor of Communication School of Communication at Bellarmine. She taught 39 years at Bellarmine. She is an emerita professor. She has 21 years of volunteering for hospice. She's a former member of the JCPS Board of Education and chair of KCTCS Technical College. And she is a member of the League of Women Voters of Kentucky and a co-president of the Louisville League of Women Voters. And we're honored that she is going to speak next. Gail Henson.
Thank you so much for organizing this event. You may think of the League as just registering people to vote and being advocates for voter rights, restoring voter privileges to people who've had felonies, but we do a lot more than that. In fact, one of our platforms is equal access to health care for all Americans, cradle to grave, and that includes behavioral health. How much is behavioral health? Can you even find a psychiatrist in this country? No, and if you do, it's private pay. How much does that cost? Our need for single payer insurance is so important, as people have mentioned, cradle to grave. Our outcomes for these children that are born in poverty, that die, or elderly people like us serve with hospice, who have nobody. They're languishing in some of these nursing homes where the Medicaid reimbursement is so terrible. It's just wrong. And for people like me who develop asthma because we live in Louisville, Kentucky, in the Ohio River Valley, this is a trilogy. This is not covered. Well, with insurance, it's $600. Without insurance, it's $1,000. I haven't gotten it filled because I have a retirement pension, I have Social Security, but why would I spend $100 for this and $200 for this and other medicine when I have other things to do? So access to health care, access to pharmacy is important. I taught social justice classes at Bellarmine. We taught the United Nations Sustainable Development Goals, and Goal 3 is universal health care for all, cradle to grave. Don't we all believe in that? Say yes. So I would encourage you to call these numbers, join with these other organizations, come to our workshops. We have 2 programs a year at the League on healthcare. We just had one on the impact of the Medicaid cuts on the 1.5 million people in Kentucky who will be affected by the big, beautiful budget bill and all the SNAP benefits. We know that hungry kids can't learn. So join us in these efforts, and thank you so much for organizing this.
And I would like to just let you know that there are some of the members of the steering committee of Kentuckians for single-payer health care who have worked very hard to make them happen. One of them is the wonderful Harriet Seiler over there in the yellow hat. And two of the steering committee members are coming up now. They are Charlie Casper and Paul Hoppy. Paul is an engineer, and he engineered this lovely structure that we have above us. But they're bringing to us a narrative designed to remember those we have lost in a healthcare system that refused to care for them, the lives that have lost. And just as our state mourned during the COVID period by ringing a bell for those who we should not have lost, but we remember, we're going to do that here. So this is Paul and Charlie.
Thank you. These are brief narratives that just underscore exactly the state of the healthcare in this country. For 4 weeks, Tracy Pike of Louisville stayed in a Texas hospital battling stage 4 stomach cancer, and his insurance carrier, Blue Cross Blue Shield, and doctors in Texas said treatment would likely cure what his insurance company refused to cover. Unable to raise the funds to overturn the insurance company denial, Tracy and his wife, Angela, returned to Louisville, where Tracy died on January 27, 2024. We mourn his death and commit to the legislation that will end such tragedies.
Between 1999 and 2020, 10,856,851 U.S. deaths would have been avoided if the U.S. had mortality rates equal to the average of peer countries. We mourn the loss of millions and pledge to enact the single-payer Medicare for All system that in the future will end the unnecessary loss of lives.
Hanneman Hospital served low-income Philadelphia residents, many of whom are African American, for nearly 2 centuries before closing its doors. Hanneman was purchased by private equity, which is a huge part of our healthcare system right now. Its assets were sold and the profits going to investors, Wall Street investors. Hanneman declared bankruptcy and closed within 2 years of the private equity purchase. It was destined to go that route. The closure greatly harmed Hanneman's patients, nearly all of whom had public insurance or were uninsured. We mourn the loss of lives and care caused by private equity and venture capital and pledge to remove profit from our healthcare system.
The U.S. has a failing healthcare system, spending double what comparable nations spend, yet ranking last in saving patients from conditions that are treatable. We will remember the lives lost and pledge to form a system based on profit to one based on care and humanity.
Americans live the shortest lives and have the most avoidable deaths. The U.S. system is the most unequal, with a greater difference between low-income and high-income individuals than in other countries. That's an incredible statistic. We condemn the health system sentences for those with low incomes and commit to a system where a person's bank account has no bearing on ability to obtain humane, compassionate care.
With an average of 20.1 maternal deaths per 100,000 live births, the U.S. is the most dangerous industrialized country in which to give birth. For black women, odds are more than double that figure, 44 deaths per 100,000 live births. That's more mothers dying in childbirth than third world countries like El Salvador. Black mothers' lives matter. For the black mothers' lives lost, we remember you and pledge to persist until we win the Medicare for system that ends the terrible disparity.
Thank you, and we are going to close with the Raging Grannies, who can begin to assemble once again. In the meantime, I'd like to ask you to stop by the table and sign in if you haven't. And there is also one of those QR codes that Dr. Krieger was talking about, where you can sign on to a petition nationally, and that gets you in the network to be a part of this movement. Following the Raging Grannies' final songs, we will gather together for the pizza that should be delivered at 1 o'clock. And we thank you all for coming, and we urge you to continue this fight. Since they've taken a little time to get set up, I just thought I might share with you the wonderful organizations that are co-sponsoring this event. These are just the Kentucky ones. There are many, many more nationally, but here it's the Kentucky Poor People's Campaign, Kentuckians for the Commonwealth, the Kentucky State AFL-CIO, the Greater Louisville Central Labor Council, the Kentucky Unitarian Universalist Justice Action Network, Louisville Showing Up for Racial Justice, the Derby City Coalition of Labor Union Women, the United Auto Workers Local 862, the Laborers Local 576, the Kentucky Alliance Against Racist and Political Repression, the Louisville Workers Brigade, the Louisville Fellowship of Reconciliation, the Kentucky Green Party Group, the Kentuckiana Raging Grannies, the League of Women Voters of Kentucky, the Louisville DSA, and Forward Kentucky. Thanks to the co-sponsors.
Imagine all the people living healthy lives and having choices. It isn't hard to do. Decisions made by doctors and APRNs too. Imagine all the people feeling more secure. You may say I'm a dreamer, but I'm not the only one. I hope someday you'll join us, and the world will be as one. Imagine much dreamer, but I'm not the only one.